Hello, welcome once again to this channel. Today we're going to talk about general overview of the causes of depression. We have been talking about the symptoms of depression, features of severe depression. So in this video we're going to talk about what is known to be responsible for causing depression. In many mental disorders, there's usually no one particular cause for any mental disorder or any condition. Even that might probably be applicable to many other medical conditions. There is no one condition or there is no one factor that might be considered to be responsible solely for causing a particular medical condition or disease, except maybe when you're talking about infectious diseases where there is a virus or a bacterium that is responsible for causing one disease, and once it's present in the body, of course it might be responsible for resulting in the disease. This is a little bit different when you talk about psychiatric or mental illnesses. So in depression, we're going to talk about causal factors that might be responsible for causing depression. One of the causes is what we call genetics. As we know, genetics is talking about things that are responsible for inheriting some certain attributes from our parents or from our earlier generations. So it is found that if a person has a family member, especially if the family member is close to them, what we call first degree relatives, they are very likely to also develop depression in their lifetimes. So who are first degree relatives? Who are relatives that are close to you? So your parents, your siblings, and your children. These are your first degree relatives, right? So if a first degree relative has had depression, there is that tendency that you may also have depression in your lifetime. And that is understandable because we tend to inherit about 50% of our genetic makeup from our first degree relatives, whereas we inherit about 25% of our genetic makeup from our second degree relatives. So if the relative has had depression, then there is every possibility that you too might have depression, and there are a lot of reasons to that. Maybe you inherited a certain gene that the person who had the depression had, and that gene has a certain vulnerability factor to it that makes you have depression. So by and large, depression might be caused by genetic factors, and if a first degree relative has had it, then there is a possibility that you might also have it. The second causal factor that explains why depression happens is called adverse early experiences, or also called adverse childhood experiences. People who have had adverse childhood experiences, such as being physically molested, being physically abused, or being emotionally abused, these are people who have had very serious issues. Remember that at that time in life, they were so young, they could not cope with a lot of stresses, and their brain is still growing. These are their formative years. So at that time, if something happens, it can be very overwhelming, and it leaves a scar, so to speak, in the mind or in the brain of the individual, so that when they grow up, there is possibility that they might become depressed later in life. These adverse early experiences can be many. So one of them include, like I mentioned, being physically abused, or being sexually abused, or being emotionally abused. These are experiences. Now there are some certain studies also among animals in which if the animal is separated from their parent from a very young age, there is a tendency that they may have a kind of development that makes them vulnerable to becoming depressed later in life. That may or may not be applicable also to humans. So by and large, however, people, when they have any unpleasant experience when they are developing, when they are young, during childhood, later in life, there's a tendency for them to have a number of psychological illnesses, including depression. The third cause responsible for causing depression is changes in brain chemistry. In our brain, there are some substances that we call neurotransmitters. Those substances are so minute, and they are responsible for communication between one neuronal cell and another. So especially in the part of the brain that is responsible for controlling how we feel, that is our emotions, our feelings of happiness or unhappiness, there is a certain part of the brain that is responsible for that. Now, those neurotransmitters or those neurochemical substances, when they are reduced in amount in those regions of the brain, that makes the individual very vulnerable to becoming depressed. Now, what is it that is responsible for causing these neurochemical substances to be reduced in amount, you might ask? Well, a number of factors might be responsible, but perhaps those things we mentioned, the genetic factors, you've already inherited a vulnerability from a first degree relative, and then additionally you may have had adverse early childhood experience, and now for some reason you are now going to become depressed, and that is going to be because the amount of those neurochemical substances in the brain have become reduced. And generally, when we give medications, one of the things that those medications do is to go to those brain regions and try to increase the amount of those substances, thereby restoring that normal feeling of normality or of happiness, or of the baseline feeling of happiness in the brain. The fourth factor that might be responsible for causing depression is what we call life events. There are generally two types of life events: the so-called positive life event and the so-called negative life events. Positive life events are obvious, right? You have a new job, you bought a new car, you recently got married. All these are positive life events. Negative life events are those things that are, of course, as the name suggests, negative. You've lost a relative, you've lost a job, you are going through a financial ruin. Any of those things are negative life events, and it is clear and it's easy to understand that depression is more likely to happen if people have gone through a negative life event. Now, those negative life events can also be classified into what we call threat events and or what we call loss events. Like if you lose something, you lose your job, you lose a loved one. So any of those loss events are more likely to trigger depression than other types of negative life events. And if you look at it, what negative life events are likely doing is to actually serve as a trigger that results in the eventual development of the depression, which means that the individual probably has some forms of vulnerability for developing the depression. Maybe the genetics we talk about, maybe the adverse early childhood experiences and what have you. So by and large, this is what life events do, especially negative life events. The fifth factor that we're going to talk about is personality of the individual. Personality is the overall way in which the person looks at the world, the way in which he thinks, the way in which he responds, the way in which he relates to his own world or his own environment and the people around him. There are people whose personalities make them vulnerable to developing depression based on the fact that either that they tend to become oversensitive to trivial stresses, or they have difficulty coping with some certain conditions, or a number of other ways in which their personalities make them vulnerable. So personality, in essence, is also another factor that might be responsible in the causation of depression. Now, it is better to look at it holistically so that there is no one factor that is responsible for causing depression. And usually these are in most cases serving as risk factors, so that it's not as if once there is presence of one of these factors, it means invariably that the person must have depression. No. What it simply means is that these are causal factors, and especially if a person has many of these causal factors piling up, then the chances for developing depression is increased. Now, the flip side is also possible, in which although the person might have some certain genetic vulnerability or some early childhood experiences, but that the person might not develop depression simply because the person had a very stable adulthood, there are no negative life events, the person later developed a very nice personality, he easily copes with difficulties and what have you. So causes of depression are many, but this is just an overview of the factors that might be responsible, especially not just one factor, but many of the factors relating with one another and being responsible for causing depression.